sort of where our project status is, as well as the market assessments, interview findings, and then talk a little bit about next steps. So, Laura, this next one I know is going to be difficult for you guys to see. This is the timeline that we presented to the transition committee that really talks about the project that CHC is working with you guys on. And the very first thing was that in October we would do the market assessment, which we did. We're going to present some of those findings to you tonight. In November, that we were really starting the medical staff plan. That is something that we are smack in the middle of and will be ready to present to you at your next board meeting, whichever, perhaps that's January. And then also November to December is that analysis of the capacity of physician practices here in the community. And so those are some of the things that we'll talk to you about where our status is. So Laura, that's the next one. So we have completed the market assessment, and as I said, we'll do some summary of that tonight. Medical staff plan, the reason that you have to do a medical staff plan is that is really looking at the community need for physicians. So if the district is interested, as you all have expressed, in helping to recruit new primary care physicians to the marketplace by paying either recruitment incentives for those physicians, then you really have to be able to show community need for that. Those are just some stark regulations. And as a result, we're working on that medical staff plan. It is in progress. With that, we do things like call physician offices, find out how many days per week physicians are in direct patient care. That way we're able to then document, based on the population, what is the actual need for physicians in terms of numbers. Okay? Analysis of healthcare providers. We have just completed the assessment of the private clinic. And remember, the reason that those kinds of things are done is that we're trying to figure out the infrastructure for any physicians that are recruited to the community. So in other words, what's the physical space, what's the available staff to support any physician, etc. And so that's just been completed. We're scheduling a call first with those physicians to chat with them about the findings, and then we'll certainly be bringing a summary to this group. From a physician recruitment standpoint, we have talked to nurse practitioners very interested in coming to the community. Where and how are still kinds of questions that are up in the air, but that is one of those things that is on our plate to really begin to talk to that provider and see exactly where a good location for that provider might be. And we held our monthly meeting with the Transition Committee on October 30th over at the residence area, where we were able to talk about some of this information and just keep the Transition Committee apprised of what was happening. So let's talk about some of the market data right now, and some of these are graphs, so hopefully we can see those. This one is really population growth, and this is talking about Houston County and the growth in Houston County. We use a data source called Truven Health. Truven takes the census data and then adds on top of that census data projections based on what's happened historically, as well as some touch points with the census. And basically what we're seeing is a pretty flat population. Between now and 2018, there's going to be a decline of about 1%. So a decline of 1% is basically pretty flat. All right? Now in Texas, we're seeing some pretty significant increases, but in the Houston County area, we're talking flat. But there is growth in the 65-plus population. That's both growing and aging in place, as well as perhaps some folks that are moving in, retirees. Now, one of the good news about that is the older we get, the more we break down, and therefore the more healthcare services we need. So we think in those terms, but you have to know that the community is really getting older as opposed to a lot of growth in that working age bracket. All right? The economics of the area, no surprise to you guys, but it does affect healthcare delivery here in the community. Your median income is lower than in Texas. Your percentage of families in poverty is higher than in Texas. You're sitting at about 16.5% right now, whereas Texas is sort of around 10, 11%. That obviously takes into consideration the big metropolitan areas within Texas. 28.8% uninsured in the Houston County area. Now, across Texas, we're sitting at about 25.5% right now. All right? So a little bit higher uninsured population. Don't know what the health insurance exchange is going to do yet. Obviously, it's been a bit of a fiasco in the media, etc. But it'll be interesting to watch what the enrollment of the federal exchanges are. Of course, here in Texas, without us expanding Medicaid, you still have folks that make less than $20,000 a year are still going to be without coverage. So they're still going to be walking through the emergency department needing services. But there may be a little bit of relief there depending on what happens with the federal exchange. The next one is really talking about the patient discharge trends. We use a data source. All of the hospitals within Texas, with a few exceptions, have to report their data to the state, to the Texas Healthcare Information Council, which is the collection of discharge data. Inpatient admission and discharge are pretty much the same thing. So I may talk admits or I may talk discharges. What we've really seen in the Houston County area is that within Houston County, and that is the chart over on the left, that inpatient discharges have gone down. They've gone down by about 566 discharges over a 4-year period of time. At ETMC Crockett, 522 of those discharges were lost at ETMC Crockett. All right? So what we're talking about is anybody who resides in Houston County where their inpatient discharges were. So there has been a decline. Now, we're seeing some declines nationally, and we'll talk about perhaps some of the reasons for those declines. This next one really looks at market share. And market share, of course, is a hospital's piece of the pie. So within the Houston County, all of those patients that would be discharged, what is that piece of the pie that those patients are going to this facility, ETMC Crockett? This is data from October 2008 through the end of September 2012. So that is our latest data. And market share has dropped. It's dropped from about 53% down to about 47%. And what that basically means is less inpatient discharges at the facility. And again, we'll talk about what those were and perhaps some of the reasons for that. Okay, Laura. Some of the declines that we're seeing is really in 3 big areas. One of them is in general medicine. Now remember, we're talking about inpatient discharges. So general medicine is sort of all of those things that might come in through an ambulance, all right? Tends to be a little bit older in terms of its demographic, but general medicine, cardiology, those discharges have declined. Pulmonary, which is any lung function, those have declined. And those are pretty much the three top areas where we've seen some declines. Okay, Laura. Now, what are some of the reasons for inpatient declines? I'm sure the hospital staff would give you more info. This is the kind of thing that we're seeing around the country that would show reasons for the decline. One of them is, of course, just that increased movement towards outpatient services. One of the things that we try to look at is outpatient services and what's that movement and what's that projection. In this marketplace, outpatient services are expected to increase and increase anywhere from 5 to about 8%. Okay, so outpatient growth is really that shift from inpatient to the outpatient, so that's not unusual at all. Increased observation admissions. And observation patients, this is a little bit of a tricky one. The federal government really has some very strict guidelines in terms of what is a patient that is in just for observation versus what is a patient that is in for an admission. And there are a lot of audits, RAP audits, that have come out where basically there's an audit that says, oops, those patients needed to be in observation, not in admission. A patient in observation is counted as an outpatient, and hospitals don't get as much reimbursement for observation patients as they do for admissions. However, that patient is still in an inpatient bed, still has the same kind of nursing care, etc. So I'm not sure about here, but what we're really seeing in many of our facilities is that folks have gotten a little concerned about audits, and as a result, those observation patients have increased, and it's causing those admissions to decline. Okay, it's sort of technical, but unfortunately, what happens is that we don't get as much reimbursement for that, and it makes your inpatient numbers look down. Economic declines. Just based on, Houston County and some of the things that may have happened here in the Houston County area, when they feel uncomfortable about their income, dollars coming in, then they don't see the doctor as much as they perhaps would in good economic times. And so elective procedures get postponed, other preventive things get postponed, and as a result, we've seen some inpatient declines due to that. Some of the interesting data, Purpose is a study that actually across the country is actually a study that asks people various questions about their health status. And one of the findings is that 32% of the Houston County respondents basically said they postponed medical care, or they didn't feel like they could get medical care due to cost. All right? Well, when we see those kinds of things, then some of the inpatient declines can come potentially. And then the very last thing is most likely the decreases in services here, cardiology, etc. As services decrease, and I'm sure the hospital has looked at demographics, etc., and that very well may be a reason for some of the decline in services. But if services decrease, then folks are going to go elsewhere, and that's just bottom line what happens from an inpatient standard.